From KETK, you're watching East Texas Live.
Welcome back to East Texas Live. Joining us now is Dr. Russell with Azalea Orthopedics, and today we're talking about what makes them unique from other orthopedic practices. Good morning.
Good morning.
How are you doing?
I'm doing great. Thank you.
Good. Well, tell us a little bit about your connection to Azalea Orthopedics and kind of what makes you guys so special.
Sure. Well, thank you. Well, again, I'm a orthopedic spine surgeon here with Azalea Orthopedics, and I've been here 26 years now.
Wow.
And so it's been a wonderful journey. What makes Azalea unique is we're the largest independent orthopedic practice in all of East Texas. We're the only one that has all the subspecialties covered. And basically, being a subspecialty group, we can really focus on each individual problem. I mean, the body is so complex, as you know, and you know, the spine is different than the hand, is different than the foot, is different than the ankle, and so having all the subspecialties covered is what really makes us and stand us apart.
Yeah, I'm sure you've probably seen a lot of changes over those 20-something years.
Yes,
how have you seen it evolved, and how has it made the care for East Texans better over those years?
Sure. Well, 30 years ago, there weren't any subspecialists. Everybody were generalists, and that's okay. That was the times. But as subspecialty practices has evolved and orthopedics has gotten more complex, to really be good at something, you got to do it over and over and over again. And so doing, you know, 1 or 2 joints or 1 or 2 spines a year doesn't really cut it. So having someone that does 500, 600 cases a year in each subspecialty is why we can get better and better and better and bring really good care to the patients, basically, and that's what it's about.
Absolutely. Well, you seem very passionate about this subject. Kind of what are your unique and experiences that you've had and successes over the years? Sure.
Well, you're talking about Azalea Orthopedics, basically?
Sir.
Well, 2 things. One is, when I came to town, it was a group that had just formed. It was, you know, Dr. Walker, Dr. Garrett, Jan Garrett, John Walker, Dr. Goodfried, several of the real kind of pillars of the community back then. And so it was a real honor for me, coming straight out of Parkland Hospital and my fellowship in North Carolina, to come in with such a great group. But as we've evolved over time, what we've done is we've just added more and more very specific, specialized surgeons that all have a passion for the community. And that's the other part that's great about it. I mean, you know, we have guys that are on the board of directors of, you know, the local school board, and as in Dr. Robbie down at White House, or we have people that are on the board of Campus Crusades, or my PA came from YWAM. You know, we have people that are really involved with the community, passionate about the community, and that's what's good for East Texas. I love being a part of Azalea.
Absolutely. Well, if someone is interested in checking out you guys, or if they're having some issues that they maybe need to get checked out, where's the best place to get some information?
Well, that's a good question. AzaleaOrtho.com is one place, and then we just recently joined with several other independent-minded groups around Texas called OLS, Ortho Lone Star, and they have a website called OLS.com, I believe it is. But we were able to join with Carroll Clinic in Dallas, Orthopedic Associates in Texas Orthopedics in Austin, and then Fondren Clinic in Houston. And so we needed to do that in order to remain independent and to continue to collaborate with the best doctors in Texas.
Absolutely. So if there's something that maybe you guys aren't able to handle, are y'all able to refer patients to those areas? Sure.
Well, fortunately, there's very few things that we have to send out anymore. Really, I can't even think of, except for maybe some very unusual tumors and things like that. But just having that collaboration has been wonderful, because, you know, we have some cases that are complex that maybe someone in Dallas has seen a little bit more than someone in Houston, or something back and forth. And so it's just been a good deal to come together like that.
Awesome. Well, we appreciate you being here with us this morning. We'll be right back with more of East Texas Live. Stay with us.